and welcome to our next episode of the Hormone Café. Today I want to go over what it's like to have endometriosis surgery here at Vera and talk about what you can do to prepare, what to expect, how you're going to feel post-operatively so you can feel your absolute best self, make sure that your questions are answered and that you're doing everything possible to heal and get your hormones back as quickly as you can. For one thing, when you're thinking about surgery, you want to act like you're training for a marathon because surgery is a stress on your body. So the month before surgery, you definitely want to be your absolute healthiest self. So that looks like you want to be exercising or working out at least 3 to 5 times a week because you want to condition your core to be able to heal faster. And then you also want to condition your heart. So in a perfect world, that would look like cardio, weights, and then pelvic floor, and then rest, and then alternating those types of workouts so that you can be as conditioned as possible to heal as quickly as possible from surgery. I also need you to be drinking at least 2 liters of water every single day so that you're nice and hydrated, and then really stay away from things like alcohol, sugar, refined and processed carbohydrates. So we don't want to be doing a lot of pastries, cakes, candy, that kind of a thing. We really want to be sticking to protein, meat, vegetables, fruit, yogurt, cheese, nuts, seeds, that kind of a thing. Just keep it really whole food based, lots of fiber, lots of vegetables. You can have carbohydrates, you just want them to be high quality grains, wheat, buckwheat, einkorn, millet, that kind of a thing. So really make sure that you're eating, drinking, and most importantly, resting, because of course the night before surgery, it's really hard to get sleep because you're going to be really nervous. And so you want to get as much rest as you can, at least 8 hours a night in the month leading up to surgery. And then you'll have usually 2 preoperative appointments, one with me or one of our providers here at Vera, and we'll do an exam and I'll show you where your incisions are going to be. And then I always make sure that your anatomy is appropriate and that we are prepared to do everything that we think we can because we don't want there to be any surprises when we put you to sleep in the operating room. So we always do an exam at your pre-op appointment, which means you have to get undressed from the waist down, and then we'll be prepared to have 4 little incisions on your abdomen, all about 1 centimeter, and I'll show you where those are. And then the hospital will have a preoperative appointment, and that will either be a phone call or in person, whatever you prefer. Some people like to go in person because they like to be able to drive to the hospital, see where to park, see where to go. Other people are perfectly happy having a phone call, and that's usually with one of the hospital nurses, so you can make sure we're following all the rules that we need to follow from the hospital's point of view. And then what else we're going to do at our pre-op appointment, we're going to go over all of your preoperative instructions, of course, go over your medical history, any surgeries that you've had in the past, allergies, medications that you're taking, and then consent you. So we'll go over all the risks of surgery, talk about the details, and then have you sign your consent form, and that will have faxed over to the hospital. And then we'll talk about any expected course of recovery for you, and then answer all questions that you have. So it's really helpful to come to your preoperative appointment with a list of your questions and then an updated list of your supplements and your medications. And then you also want to make sure that your surgeries, medical history, medications are all up to date in your Charm patient portal so that we can look at that ahead of time and then guide you on what you need to stop prior to surgery. And then the week leading up to surgery, things that are important is that we don't want you to be pregnant when we're going to have surgery. So you just can't have sex from cycle day 1 up until your surgery, because if we're going to put a camera in your uterus, we want to make sure that you're not pregnant. So usually patients who are trying to get pregnant, our fertility patients, will have you take that cycle off of trying, and then you can start trying your very next cycle. So you only have to avoid intercourse for 2 weeks after surgery. So usually you can try that next cycle. So we try to only make you take 1 cycle off of trying. And then the week leading up before, you want to, of course, stop any NSAIDs, so any Aleve or ibuprofen, any omega-3s, or any blood thinners 1 week prior. And then you still want to continue to make yourself as healthy as possible, eat really well, exercise regularly, get enough sleep, especially that week leading up to surgery. And then the night before your surgery, I want you to carb load like you're training for a marathon. So then you want to have a really high protein, high carb, high fat meal because you're not going to be able to eat or drink anything after midnight. So I really want you to be nourished leading up to surgery. And this will give your body energy to power you through surgery and recovery. And then I also need you to drink 2 liters of water that night before, take any of your nighttime medications, and then you do have to stop eating and drinking at midnight. Other things that are really helpful in that week and that day leading up to surgery are to meal prep. It's extremely important to have healthy meals and healthy go-tos because the last thing you're going to want to do when you're recovering from surgery is cook. So having frozen smoothies in your freezer or in your fridge, having go-to frozen meals that you can just pop in the freezer, pop in the oven, or put in the microwave or heat up quickly, having bone broth and soup and lots of nourishing foods that are warm and nutritive but digest properly is really, really helpful. So and then make sure that when you're recovering, you have your nutritive foods and your village. Having prepared for other people to come and help you is also really important. This is not something that you want to do alone. You're definitely going to need help for the first around 2 to 4 days. You're going to need somebody to help you get in and out of bed, help you go to the bathroom, help you move around, and then help make sure that you're drinking water and nourishing yourself appropriately, help you take your medications on schedule. So it's really important as part of your surgery prep to make sure you have your village, have your people who are going to help you, and then have your meals prepped. Have lots of water, electrolytes, healthy snacks, good meals, smoothies, bone broth, soups. And then the day of your surgery, you cannot eat or drink anything after midnight. I had a patient who one time walked into pre-op with a water bottle and they canceled her surgery because she was drinking water leading up to surgery. So please, after midnight, you can't eat or drink anything. The only exception to that is there's something called an Ensure pre-surgery drink that we'll give you at your pre-op appointment. It's unfortunately full of sugar. It's 50 grams of glucose in one drink, but it's the drink that anesthesia allows you to drink just so they could know exactly what was going into your body. So I definitely wouldn't recommend drinking the entire thing. Otherwise, your glucose is going to plummet after that insulin spike. However, it's really dry in Denver. So if you're dying, it's absolutely okay to have a couple sips of Ensure pre-surgery. It will keep you a little bit hydrated up to 2 hours before your planned procedure start time. So 2 hours before your surgery, you're allowed to have little sips of something called Ensure pre-surgery. And then the morning of surgery, you don't want to have anything in your stomach, like no vitamins or supplements. Sometimes we'll have people continue their thyroid medication that morning and things like that. So make sure you discuss that with us when we talk about your medication list. But in general, we almost never have you take your medications or your supplements on the morning of surgery. Other things that you want is you're obviously going to want to bring a support person with you. So you do need to have somebody to drive you home from the hospital, and their contact information will be given to the hospital. And then your support person will be called with any updates during surgery, and then they're texted when your surgery is finished. And the hospital is very strict about who you leave with. So you do have to make sure that you have someone to drive you home. And then you're going to want to get to the hospital 2 hours before surgery. So you'll park across the street, walk across the street, walk in the front door, tell them that you're there to have surgery. I have my own special area. Everyone that does robotic surgery at Swedish Medical Center, we have our own little area. So you're not in the same area as everybody getting their hip replaced and their gallbladder out. And I have an amazing team, and they know all of the anal stuff that I do. So the nurses will bring you up to robotics, which is our preoperative surgical area, and then they'll make sure that your insurance is correct, make sure you don't need to have any additional forms signed. And as far as preoperative, it's a lot of hurry up and wait. You'll do a whole bunch of stuff, and then you'll wait around for an hour, and then you'll do a bunch of stuff, and then you'll wait around. So sometimes it's helpful to bring something to do. You can watch a movie, you can read a book. Sometimes nerves and anxiety can be high during this time, so it's helpful to have something to distract you a little bit. And then they'll bring you up to our preoperative area. You'll be given a hospital gown to change into, and then you'll have to remove all jewelry. So please remove all jewelry ahead of time. Just don't come in with any jewelry or anything that's important to you. And then right before taking you into the operating room, we'll have you remove any glasses, anything that can be removed. And then the hospital staff will give you a bag to keep your belongings in, or you can give that to your support person for safekeeping while you're back in the operating room. And then you'll always have an identification bracelet and an allergy band around your wrist to wear throughout your stay. And they'll probably ask you your allergies 10,000 gazillion times while you're there, just to make sure. And then the pre-op nurse will review your medical history and then help you get any preoperative medications that you need. They'll put an IV. And then if you're doing PRP, which we usually do, we'll draw your blood right there. And then we usually draw your blood work just to make sure that your blood counts are okay, kidney and liver function is okay. And then you'll meet me before surgery. You'll see your anesthesia doctor, and then you'll meet your operating room team. So if you have any prior issues with anesthesia, please discuss that with your anesthesia team, because they'll literally make a specific cocktail just for you. And depending on how nauseous you get during procedures, are you a person who tends to get nauseous or not? How well do you do with anesthesia? Please make sure that you tell them all those kind of things so we can prepare as best as possible for you to have a best recovery as you can. And then I'll see you, of course. We'll discuss any last questions that you have and go over any concerns before we take you back. And then after your surgery, you'll wake up in the recovery room. It's called the PACU, or post-anesthesia care unit. And usually you'll wake up in a room surrounded by strangers. So just be prepared for that. They won't let your support person come back into the PACU or the post-care unit until you're wide awake and basically doing jumping jacks. So just remember that you're going to wake up and you're going to feel a bit foggy and your stomach will be pretty sore. Sometimes you'll remember seeing your doctor and sometimes you won't. So just be prepared that it might take you a while to wake up. Some people wake up quickly, some people wake up a bit slowly. And then usually I review everything that was found in your surgery with your family or your support people, or I review it with you in the post-operative, or I call you, just depending on how fast you wake up. And then in the PACU, you'll be cared for by a team of nurses and your anesthesiologist, and they'll give you any needed pain medications or nausea medications or anything that you need. And just remember, all they have for you to eat and drink in the recovery room is juice, water, Jell-O, pudding. So if you can't tolerate these foods, and they're generally not recommended because usually you don't want to be having a bunch of high fructose corn syrup when you've just had a major surgery. So I do recommend that you bring your own alternative options with you. They'll have things like water, and we'll make you drink a lot of water in recovery, for example. But sometimes it's helpful to bring electrolytes or toast or oatmeal or bone broth or something that you know is nourishing but easy to digest. So you can have your support person bring anything to you in recovery, and then the nurses can help with that as well. So not that you cannot have juice or Jell-O, it's just that you might want to bring something a bit more nourishing and healthy for you. And then your support person won't be allowed to come back until you're wide awake. So just remember that they'll have to stay in the lobby for a while, even after you go into recovery. And then sometimes usually you'll leave for recovery. You'll spend about an hour in the recovery room, and then you'll go home. And then we do have to wheel you in a wheelchair down to your car. So usually a support person will go grab the car, bring it around to the front, we'll wheel you down, and then put you into the car. Just remember the car ride home. It can be a little bit rough. Some people do great. Some people get really nauseous. It is within normal to throw up within the first 24 hours of your surgery. Hopefully you won't, but sometimes people get in the car and they just don't feel that great. So it's helpful to have a nausea bag in the car, and it's also helpful to have something like a towel or a pillow to hold over your stomach, because if you want to laugh, cough, sneeze, take a deep breath, it can really hurt. So it's helpful to hold a pillow on your stomach and then be able to cough or sneeze so that you're not putting extra pressure on your abdomen. And then for the first 48 hours after surgery, I'm going to have you take Tylenol, which is acetaminophen, 1,000 milligrams every 8 hours, and ibuprofen, 600 milligrams every 6 hours. And we have a protocol called Enhanced Recovery After Surgery, or ERAS. not to be confused with Eras, which is the Taylor Swift tour. And that is this whole protocol that we do to make sure that you recover and can get back on your feet as quickly as possible. So taking scheduled Tylenol and ibuprofen will help decrease the inflammation and decrease the pain as fast as possible. So please take these medications on a schedule, even if you're feeling good, because they'll decrease your pain and inflammation. And then after the first 48 hours, then you can take those medications as needed. I usually also give oxycodone 5 milligrams. Sometimes people don't need it at all, and sometimes it can be helpful to use if you're having trouble sleeping or if you're about to go on a walk and you're feeling really sore. So you have that as a backup just in case you're in a lot of pain. However, if you are in significant amount of pain and it's not making sense and the pain medications aren't helping, that would definitely be something to call us about right away. Other things to be cognizant of is that you're really going to want to sleep on your back because you'll have incisions on your stomach, and those incisions can really hurt and be really sore. So it's not going to feel great to sleep on your stomach or to sleep on your side. So if you are a stomach or side sleeper, you're going to want your bed to be prepared with all kinds of pillows so that you don't accidentally roll over and hurt yourself in the middle of the night. So just be prepared. You're probably going to want to sleep on your back and be really propped up on a bunch of pillows, especially for the first couple nights. Also, in order to do surgery, we have to put gas in your abdomen, and so that can really stun your intestines. So I'm going to have you take a stool softener twice a day until your bowel movements are very regular. Because, of course, having surgery stuns your intestines. It can really slow down return of your regular bowel functions. And then all those medications, so your Tylenol, your ibuprofen, your oxycodone, and your stool softener will all be sent to your pharmacy ahead of time. So if it's not at your pharmacy, or you're unable to pick it up, please let us know right away so that you can be prepared with your medications and you don't have to go get them on the day of your surgery. If there's any other post-operative medications that you need, like if you want to go home with nausea medication or anything else, please let us know. We can definitely personalize it to your situation. And then during surgery, I put a catheter in your bladder to make sure that your bladder is draining properly while you're asleep, and then it's removed before you wake up. However, sometimes having a catheter in your bladder can make you feel some burning or discomfort when you pee for the first 24 hours after surgery. So it can feel like your bladder is a little bit slow to pee, like you're sitting on the toilet and you have to wait a little bit for the pee to come out. And you can also feel like you have a teeny bit of a UTI or a little bit of irritation for that first 24 hours. So if you're unable to pee for more than 4 hours after going home, that definitely be something that you want to call us about, because we do want to make sure that your bladder is back to itself and working well. Other things to expect, you can have some light vaginal bleeding similar to a moderate or light period for the first 7 days after surgery. Because I put a camera in your uterus and look around, sometimes it can give you a mini period. And whether or not it will affect your period timing depends on when your surgery is. For example, if your surgery is after ovulation, then your regular period will come on time. So you'll have your post-surgery bleeding and then you'll have your regular period. If surgery is before ovulation, sometimes the stress of surgery can delay your ovulation for a couple days, which means that your period might come a couple days late that cycle. And so you'll have a couple funny types of bleeds, because the bleed that you have after surgery will be almost like a light mini period. And then when you get your first period after surgery, oftentimes that can be just kind of a bizarre period, meaning you might have a little bit heavier or lighter than you're used to. It could be more brown, past tissue, past clots. And also the first period after surgery can be really painful, because that's when your body's inflammation is either high or just starting to go down. So just be warned, that first period after surgery can be really painful. The next period will be better. And the third period after surgery will be your new normal. So that's what you can expect as your periods. And then we're going to flush your fallopian tubes, the medical word for that is called chromoperturbation, and that's done with methylene blue. Methylene blue is wonderful because it has a lot of antioxidant properties. However, it is bright blue, so you might have some blue vaginal discharge. Please wear underwear that you can throw away or don't like or can get stained. And then a lot of people do experience post-operative nausea. Sometimes people throw up. Sometimes people feel great after anesthesia. So when you go home, please be prepared to eat something bland like toast, oatmeal, soup, bone broth, and then make sure your stomach can tolerate food. Sometimes you're going to feel really hungry when you wake up because you haven't been able to eat all day, but other times you really won't have an appetite. It's really important to listen to your body and never force food down if you're not hungry, because that means your bowels and your intestines are not ready to accept food. So sometimes you'll go home and think, oh, I'm not really feeling like eating, but I should eat something because I haven't eaten anything all day. Don't ever force food down if it doesn't sound good. If something sounds good, by all means, you can eat it. If it doesn't sound good, then don't feel like you need to eat. Eventually, you get your appetite back and you can eat when you feel hungry again. Other things I want you to do, I do want you to get up and walk around your house the day of surgery after you go home, because we need to get your bowels moving and get blood flowing to your intestines. And then we also need to prevent blood clots, especially in your legs. But you don't want to do any strenuous activity, especially the first week after surgery. It's okay to walk short distances, so you can walk 1 block at a time for the first 2 weeks after surgery, and it's okay to go up and down stairs. It's not going to feel great to go up and down stairs. You're going to have to do it really slowly, but it's okay to do it. It's not going to damage anything. Other things to take into consideration, because I have to put gas in your abdomen to look around during surgery, sometimes people get gas pain. And what that feels like is almost like they feel bloated or puffy after surgery, or you can almost feel like there's this knot or this bubble under your ribs right by your liver on the right-hand side or on one of your shoulders. And that can just be almost like a really, really bad kink in your neck that's going to take a couple days to go away. So what you want to do is make sure that you gently massage the area, move your arm, do little twisting motions if it's in your abdomen, and then take deep breaths, because what the gas is CO2, so it's what you exhale. And we just need to make sure that your body processes it off. So make sure you walk around, move or massage, and then you can also use heat packs. So it's also really helpful to have a heating pack prepared after surgery, just in case you need heat. And you can also put heat on your abdomen if you're sore. Things that you need to think about in terms of exercise and lifting. You can't lift anything more than 25 pounds for 4 weeks post-op. Sometimes I have to put internal stitches, so we don't want you to rip your stitches. So we don't want you lifting anything heavy, so you're not putting pressure on your abdomen. And then I don't want you exercising or doing any squatting or lunging positions for 4 weeks, because that can also put too much pressure on your abdomen. And then after 4 weeks, you can resume exercise at half your prior regimen, because you're going to be a little bit deconditioned. So you don't want to start exercising full force right away. You want to work yourself back up to exercise. So for the first 2 weeks after surgery, you just want to do short walks. Between 2 and 4 weeks, you can do light things. You can do yoga and stretching. And then after 4 weeks, you can go back into your full exercise routine slowly. You can't drive for a week post-op, so if you need to go anywhere, do be prepared to have somebody drive you. And then you can't have intercourse for 2 weeks after surgery, because we want to make sure that your reproductive organs are able to heal. When you wake up, you'll find that your incisions are sewn closed with absorbable sutures or stitches, so they'll dissolve. You don't have to get your stitches removed. And then they'll be covered with white steri strips. If you're somebody who has a lot of sensitivity to adhesives, please let us know, because there can be alternative things that we use. And so you'll have 4 different areas with little white band-aids. And then I usually put lidocaine for pain relief under your incisions right before you wake up. And so sometimes in the first 24 hours, it'll seem like your incisions are oozing a little bit, and there'll be this little bit of clear fluid mixed with blood tinge coming out of your incisions. Sometimes it can also just be a little bit of blood. Some blood will come out. We call it breathing. Your incisions will breathe a little bit for the first 24 hours. That's okay. Just leave the steri strips, just the little white band-aids, just leave them on. Don't take them off until your 2-week post-operative appointment. The only way that I'd want you to take them off is if you were having an allergic reaction to the band-aids, like they started itching really badly, or you could see red bumps or a rash around them. Then you want to take them off and send me a picture. You can put other things over. So for example, if you want to put some gauze or some band-aids to absorb that little fluid that's leaking out, but I just don't want you to remove the band-aids unless your skin's really irritated. You're going to want to wear clothes that are loose and comfy and aren't going to rub on the incisions, and that if they get slightly stained with blood or fluid, it's not going to bother you. And then I don't want you putting anything on your incision, so no lotion, no cream until it's checked at your post-operative appointment. And then after 2 weeks, we do a skincare regimen to try to dissolve any scars or scar tissue. But for the first 2 weeks, I don't want you to put anything on it. It's okay to shower. You just want to let the water run over your incisions and then dab them gently. You just don't want to take a bath or swim or submerge your incisions until they're checked at your post-operative appointment, because we do need the skin to be healed and completely closed before you were to bathe or submerge your incisions. Things that we'd want to know are if you have a fever above 100.4 degrees, please call. Sometimes, because surgery is an inflammatory reaction, you will get a little bit of a low-grade temperature for the first day or two. For example, you might get a temperature to 98 or 99 degrees. Anything over 100.4, you definitely want to call us. And then if you have vaginal bleeding for longer than a week, or you're bleeding through more than 1 pad an hour, that would be definitely a reason to call. If you have abdominal or pelvic pain that's just getting worse and worse, and the Tylenol and ibuprofen just isn't cutting it, that would also be a reason to call. If you were throwing up or you were really nauseous for more than 24 hours after your surgery, that could be a red flag, so please call. Or if your incisions are separating or opening under the Band-Aids, definitely send us a picture and then give us a call so we can tell you what to do. When we think about work, if you have a really active job, you have to be moving around, lifting things, bending. I recommend that you take 2 weeks off of work. If you have a more sedentary job where you could sit in bed and just be on your computer, you'll probably be able to do that for about a week. But you're going to want to take at least 1 week off of work, because for the first 2 weeks after surgery, you're going to be really, really tired. Even for the first 4 weeks, you can just be really exhausted. So you do have to be prepared to take naps in the middle of the day, rest, go to bed early. You're not going to be necessarily wanting to work an entire full day. And then if you have any medical leave paperwork required by your job, that's something that you'll get from your employer and bring to us, and we'll fill it out and either give it back to you or send it back into your employer. So the sooner that you can get that to us, the better, so we can get that ready for you and fill it out. I just want you to remember the first 2 weeks of recovery are very rough. You have to remember that it's almost like you're in a boxing match for 2 weeks, because your abdomen will be really sore and you'll be really tired. You really want to mentally prepare for the fact that your body literally needs to rest and heal, because sometimes it's easy to overdo it and just want to go, but we have to remember that we do need to rest and we do need to take it easy. The more we rest and we let our body heal, the faster we're going to be able to recover, the faster our hormones will be able to come back. Because in the beginning, our body will put a lot of energy into healing and not so much energy into making hormones. So our hormones can be lower in that month after surgery. So we really want to be resting and eating really nourishing food throughout the day. So we're literally giving ourselves enough nutrition and calories in order to make hormones and to heal properly and decrease inflammation from surgery. So you'll feel about 50% back into your normal self in 2 weeks, 80% back in 4 weeks, and almost 100% back to yourself in 6 weeks. So you do want to expect like a full 6-week recovery, but there's really big milestones. At 2 weeks, you'll turn a huge corner, and then at 4 weeks, you'll turn a big corner too. And then we'll have 2 post-operative appointments. You come and see us 2 weeks after your surgery, and we'll go over your surgery details, go over your pictures, answer any questions, and then we make a follow-up plan. So usually after endometriosis surgery, we'll have you take certain medications, certain supplements, do a certain endometriosis diet, just depending on what was found in surgery, because the whole goal is that we really want to make sure that we decrease scar tissue as much as possible, prevent endometriosis from growing back, and bring down inflammation. And overall, I really just want to make sure that we reiterate that you want to be prepared to rest after surgery, so have lots of things to do so you don't get bored, because it can be really boring going back and forth from the bed to the couch to the bathroom for 2 weeks. And then you do want to have a village, so make sure that you have people there to help you, entertain you, bring you food, talk to you, make sure that you rest. So make sure your village is there, and then make sure that you have healthy meals prepped, lots of water and electrolytes, so you can get back to yourself as quickly as possible after surgery. If you have any questions, don't hesitate to reach out. We are happy to help you. We have a very specific surgery protocol so that we can get you the outcomes that you want as quickly as possible and help you heal as fast as possible. I am rooting for you on your journey. If you have any questions, please message us on Instagram at Vera Fertility or give us a call.